Hi, my name is Kathleen Stoneman, and I wanted to set up all these videos that are going to be in the series for you to understand the background because I decided at the last minute on my way to the trip for my surgery to make some videos, but I didn't cover all of the details in all the videos. So, this video series is about my journey with dentistry, biological dentistry, Swiss Biohealth all-in-one surgery. And I wanted to set it up by explaining how I found the diagnosis and what kinds of symptoms I was having before we watched the other videos, so you have a sense of it. Now, going back to 2014, I was in a car accident and I did have a neck injury. And then in 2019, I fell walking my dog and separated my left shoulder and hurt my neck and hit my face. And it is possible that from falls that you can cause dental issues. I also fell on the sidewalk in 2003 and broke this tooth. So I had some chronic neck issues going into this whole process of finding out about the dental issue. But I wanted to just list the symptoms that I had immediately before going in for the surgery in January of 2023. One of the main things that I had was horrible migraine type headaches that would cause nausea, extreme light sensitivity, sometimes vomiting. We're talking 8, 9 pain. Medication didn't touch it. I would be in bed for 1.5 to 3 days. Um, and the light sensitivity wasn't only during a flare-up. I had gotten to a point where I was wearing my prescription sunglasses, which were the darkest I could get made in the house at different times. And I would forget I was wearing sunglasses because my eyes were so sensitive. Um, but one of the other major symptoms I was having was um, eye pain, severe, sharp stabbing, nerve eye pain, and nerve pain around the front of the ear and the cheek and the forehead. I had no nerve pain or any teeth issues, no tooth pain whatsoever, no nerve pain in my mouth. There was nothing that would have indicated to me that I was having a dental issue. In addition to the nerve pain and the migraines, the immune system was a huge issue. I had swollen glands all the time. I had kind of a chronic cough and the postnasal drip kind of felt like my immune system was fighting something all the time, although I rarely ever got really sick. Uh, so this drainage, this low grade stewing makes so much sense now that I learned what it was. So around 2020, I heard about the 3D bone CT scan that can do a really good job seeing if there's infections. Especially, I had originally 7 root canals. One had been pulled, and I had a bridge because I wasn't ready to do an implant. And so I had 6 root canals. I had 1 titanium implant, and I had just this chronic head symptoms and chronic sinus and throat symptoms. So I knew when I heard about getting this to see if you had infected root canals that that might be something that was going on with me. So to go back, I had a lot of dental issues as a child. I had bottle mouth when I was an infant, so my baby teeth had a hole between them, the 2 front teeth with like black caries, infection, decay around it. They hospitalized me when I was 5 to put amalgam filling caps on all my molars, trying to save them. Um, and I believe I was 12 when I had my first abscess on one of the molars and had my first root canal. And then eventually in the teens to the early 20s, I had 7 root canals. And then later, in the mid 2000s, single digits, I redid all of those root canals because they were so old, they all needed to be redone. And at this time, it was all conventional dentistry. So there was all these different metals, things going back to the 80s and um, all the different materials in there. And when I learned in 2020, some other YouTube video talking about that you can have apical infections at the root of a root canal, I went and did my research and learned about Weston A. Price and his research about taking infected teeth out of humans and putting it under the skin of a rabbit, and then the rabbits would get the illnesses that the humans had, and that you can't fully um, disinfect or sanitize or clean out and fully kill the bacteria in an infected tooth because teeth are alive, they're an organ, and they have all these tubules in the dentin and in your tooth are not solid. They have all of these tubules and they're more porous. And when you do a root canal, you're taking out this live organ. So you're scooping out the root, all the blood supply, your body's immune system, your body's ability to actually go in and get rid of an infection if it was able to. Um, it's completely gone once they take it out, and then they're leaving a dead organ in your mouth. And because they can't fully clean it out, what happens is you're having this dead tooth in your jawbone, and that bacteria is still in there. So, an apical infection or a cyst at the root of a root canal, you can see on a CT scan, but you can't always see them on a regular standard radiograph x-ray at a conventional dentist. So, a CT, the threshold of what you can see is much more powerful. You don't have to have this infection be very intense to the level where it's required to see it on an x-ray. So I knew that I wanted to get those checked. And in 2022, I went to a biological dentist in the United States to see what happened, what was going on with the CT. And she gave me a treatment plan that was to take out all of the infected root canals and to clean out something called dental cavitations. So when my wisdom teeth were removed back in 1987, um, the theory is that if they don't fully clean out the dental ligament that was holding that tooth on in the wisdom teeth surgery, then sometimes you'll get an necrosis and infection in the bone, and then the bone doesn't fully heal. Now, me understanding who I was back in 1987 and how I was eating and what I learned in order to prepare myself nutritionally for this large surgery, night and day. I mean, I was in college, I was a junk food vegetarian. Um, I wasn't eating the collagen and the meat and the protein and the healthy fats that your body needs, along with the right kinds of calcium and magnesium and vitamin D and minerals to build bone. You need collagen plus the minerals to build bone. So I feel like nutritionally that played a part with me in retrospect. And I think of all of the college age girls who are, not eating as healthily as they could, having these dental surgeries, taking out their wisdom teeth. And if they're not eating properly to be able to have their body rebuild the bone, that could also be part of the situation. Also, I did have an allergic reaction to the medications with my wisdom teeth removal, and so I was vomiting. So there could have been bacteria and maybe dry socket or something that happened because I was so sick the whole week after the wisdom teeth were removed, wasn't eating. Then they were trying to give me medicine to not vomit at the time, which was funny because you're taking a pill and you're vomiting. It wasn't like you can have the dissolvable ones now. Um, so we can speculate what causes these things, but I know nutrition plays a big part of it. And then if if it was because of the vomiting afterwards or they didn't get all of the dental ligament, who knows? But all four quadrants had uh, a hole in the bone with osteonecrosis. And in my case, not just fatty osteonecrosis. If you look up pictures of it, there was literally pus pouring out of the bone. My surgeon was like, Kathleen, this was bad. So grateful to have that out of there now. I've been doing a lot better since then. Um, so I had a consultation with the surgeon in Costa Rica who was one of the facial maxillary surgeons who trained the biological dentist who originally took the CT scan. So I found the place where the dentist here was trained and went to those, contacted that office, and the surgeon did a Zoom call and reviewed my CT scan and was very concerned about what he saw, about how it was affecting my immune system long term and the bones. And so I ended up scheduling an all-in-one surgery with him. So after I scheduled that appointment, I went on a deep dive into the research about cavitations, high dose vitamin C IVs, what diet was helpful, what supplements were helpful, because I really wanted to set myself up for full and complete healing. And once I found out that what they told me was going on, and they had diagnosed it with NICO, or neuralgia-inducing cavitational osteonecrosis, because of the nerve pain and the head pain and the facial pain. I was really hoping and praying that was going to be the end all treatment, and it helped so much. Again, at that time, I didn't know I also had damage to the ligaments that hold my skull on. So the videos are pretty raw. Um, they are just me having my experience. They are not meant as medical advice to anyone. Do your own research, see your own doctors. Um, but it might give you ideas of what to additionally research to learn what you need to know to help your recovery. I also did Invisalign in Costa Rica based on recommendations, both from the dentist in the United States and my surgeon. If I'm honest, now I wish I had not done that. They don't really talk a lot about how you're going to have these plastic trays in your mouth for every night for the rest of your life. And I don't want metal in there, so I'm not going to let them put a metal retainer behind my teeth to hold that in. So if I had to do it over again, I would not have pursued the Invisalign. Um, but I did at the time, and it was the day after surgery that I went to see the orthodontist. And that day is kind of a blur. I was high. I was so happy. My body was like, wow, no infection. Like I felt like $1 million. Also, they gave me pain meds in my IV that morning. Um, and I'm sure I was kind of on a cloud just because of everything that had happened and good things that happened. But in retrospect, I wish I had not pursued Invisalign. So definitely do your own research about all of that. I've broken like 7 retainers in the last 2 years, and it's usually one certain one. And so I have all these mixed sets, and I've had to buy multiple final retainers. Um, it's it doesn't end. So I hope these videos are helpful for you. And again, it's not medical advice, but it's also just trying to share and be of service of, I made it through from having these mystery, horrible symptoms to finding out that it was related to things in my mouth. Let's proceed on with the journey of videos of my dental surgery.